Many of us exercise, we watch what we eat, and yet we have stubborn pockets of fat that just will not go away. If you want to target those areas, why not try Smart Lipo? It is a minimally invasive way to slim those stubborn spots. Joining me with more, Dr. Therese Stubbs, who specializes in aesthetic medicine. Dr. Ann, nice to have you here.
Nice to be back.
You specialize in aesthetic medicine. What does that mean?
Aesthetic medicine is basically non-surgical procedures that can be done in an office setting that help people look better and feel better about the way they look.
Mostly cosmetic in nature.
Yes.
So you have many things that you offer, but today we're going to concentrate on Smart Lipo. Minimally invasive. Does that mean that there is some cutting involved, or how does this work?
There's basically a little bit of local anesthesia. So there's no general anesthesia. There's no putting somebody to sleep. It's a local anesthesia of the area we're going to melt fat, and then a tiny little needle stick, and you can put a laser right through that needle pinprick, and you can run that little laser back and forth. It looks like a piece of angel hair pasta.
That's
really
tiny then.
Very tiny. And it's more like playing a violin. You just kind of run it back and forth, and it melts the whole fat layer. So you've got skin on top, you've got a layer of fat, you've got muscle underneath that, and we are just melting that layer of fat, and when it becomes liquid, you can put an equally small little catheter in there that's like a straw, and it suctions that liquid out.
So you can actually see the fat.
Oh, yes. It's very satisfying to some of the ladies who have it done, and men too.
Yes, to say, here it is.
Yeah.
I know that something happened,
yes.
Basically. What areas are the best when you target areas for folks that this works best?
Well, the beauty of the laser is that you can use it in areas that traditional liposuction has not been effective, just because traditional liposuction is a lot more traumatic. It's a larger trocar going in, and this is a tiny little thing, so we can do arms, we can do chins, we can do bellies, we can do what people call love handles, or kind of muffin tops above the low-cut jeans. We're looking at a chin before and after here.
That is, the pictures sometimes tell the story best.
Yes.
Wow.
And that's 45 minutes. You're in and out of the office. You can drive yourself home.
And even though it's in the neck, are we talking any sort of pain with this?
We do numb up the area
right.
with the local anesthetic, and that lasts for about 6 to 8 hours. So the patient's numb for 6 to 8 hours when they go home. And then maybe a little bit of discomfort that you can take Tylenol for. No one's ever needed a prescription for pain medication thereafter. It's pretty comfortable.
And then we just saw the tummy as well. So I would think that that's probably an area, especially for women, that come in and ask about.
Most satisfying, I would say. Tummy and probably love handles, that whole middle section, people find after a certain age with hormone changes or just with certain things after
Babies,
children.
Yeah.
Exactly. There's a little pooch above the C-section scar, and even you wouldn't imagine how many men come in after a certain age, and they're working out, they're eating right, and they still have a little bit of fat right around the waistline that they can't get rid of.
Do you discuss those sorts of things with your patients? Before we do this, are you doing the exercise? Are you eating correctly?
Definitely.
To make sure that, and there's some maintenance with this when you're done, I suppose.
Definitely. We don't make new fat cells as adults. So once we take out the existing fat cells, you can still expand and contract the ones that are left. We try to leave a little layer there so that the skin looks normal. You don't want to suction all the fat out, or the skin tends to have a rippled type effect, and you've probably seen some hideous pictures in Us Weekly and things of that nature of the stars who've had over suctioning or too much of the procedure done. So we leave a little fat layer there, so you can still expand and contract that layer. So if someone leaves my office and goes on the Krispy Kreme diet, they're definitely going to gain a little bit of weight there.
But the results are immediate.
Immediate, and people will go home that day and even see a result, and then the tissue continues to tighten over the next 4 to 6 weeks. You get some tightening of the skin over top of the area that you did, because the laser heats the skin.
Well, that's very interesting, because I have seen video of the regular liposuction, and that really looks serious business.
Very traumatic.
Yeah, very traumatic to the body.
Yes.
Okay, you said, all right, ask this question. What is the one beauty thing that women and men should never leave home without?
Sunblock. I would say sunblock, even in the wintertime. We all know about the damaging or cancer-causing rays, but there are UVA rays, which are longer and go through windows, go through windshields.
And it's summer.
Yep, those damage your collagen. So that's the thing. UVA and UVB block, and spray it on your kids too.
Dr. Ann, nice to have you here. Thanks.
Thanks for having me.